Good morning and greetings to Honorable Chief Secretary Sir Shri Dharmender ji, Ms. Alice Sangsson ma'am, Mr. Vipin, Dr. Dilip, Mr. Boni Kapoor ji, and of course Dr. Sareen, and all my honorable teachers, seniors, colleagues, and peer groups. I find myself very privileged, honored to be welcoming all of you on this very important, auspicious, I call it an auspicious occasion because this has become more like a festival from the sustained efforts of Dr. Sareen. And I was just mentioning in the morning to Dr. Sareen that I have known him since 1973. I was 9 years old that time, and since then I have been a big fan of his. I find myself really privileged to be hosting this. I'm one of the co-hosts from the Directorate of Family Welfare for this auspicious festival, which is very important in spreading awareness about hepatitis. So this is a global menace. In India, the burden is a lot. I will not talk more about the hepatitis, but I am really thankful to my Honorable Chief Secretary Sir and Changson ma'am for extending lots of support for tackling this important issue. From ILBS side, from Dr. Sareen's side, the sustained efforts initiated long time back. So we can see it is 27th Hepatitis Day. Much before the ILBS was formed, much before the National Viral Hepatitis Program was launched in 2018. But the awareness, he became a torchbearer for spreading the awareness, and all of us joined him. So I welcome everyone in joining hands with us to spread the awareness about this program. I would like to mention at this point of time that it has to be a team effort. So the team has to build up, and the team from Health Department of Delhi government is definitely putting their efforts in this. The certain very important things are, we have initiated the treatment centers, and one of the model treatment center is at Lok Nayak Hospital. MD Lok Nayak, Dr. Suresh is here. In the past 5 years, they have been able to treat more than 10,000 people, 10,000 patients. We are providing from Delhi government free treatment, free diagnosis, free consultation, and admission whenever required. So in addition to the model treatment center at Lok Nayak Hospital, we also have 6 other centers in Aruna Asaf Ali, as well as 5 of the polyclinics also have. So in all the districts, we are trying to cover it. But the theme that Dr. Sareen told me all the time was prevention. He always said that prevention is always better than the cure, and Directorate of Family Welfare, the basic intent of Directorate of Family Welfare is prevention. So we start the prevention even before the child is born. The maternal health has taken a great lead in that, and I am really pleased to announce that in the maternal health, Dr. Jyoti is sitting here, who is the State Program Officer for Maternal Health. They have achieved 100% coverage of screening of pregnant women in Delhi. They have achieved 100% coverage of providing the vaccination whenever required. We have achieved 100% coverage of providing the first dose of hepatitis B to the newborns. The immunization division is also doing a great job in that. The child health program is also taking up. And I was really, I was interacting with the students in the morning, who came in the morning, the nursing students, the school students, and we were talking about the heritage school also. So I request Dr. Sareen at this point of time that, sir, I would like you to join our adolescent health program as well, because this is another program that we are, it is really gaining momentum now. Because of certain logistic constraints, we were not able to do that much of school health screening, but now it is being done. So, sir, if after this session, I would like to interact with you and take it further for the schools of Delhi, government schools and as well as the private school. So ma'am is there from Heritage School. Ma'am, I would like to take your commitment for involvement in that. And I never lose an opportunity to promote my own program. So at this point of time, I would like to mention that this Sunday is the polio program. So please spread awareness about the polio day also. But this is only a side track. Coming back to the hepatitis day, I would again request all of the participants who are present here that you have to behave like a torchbearer. You have started the day to day. This is going to be a week long and then a month long program. Lots of activities are being initiated at this point of time with the initiative of Dr. Sareen, which includes the free hepatitis vaccination, the free FAB scan, but that should not be limited to 1 month. The intent of this whole celebration is that start the awareness and then sustain it. Like Sir has sustained it for 26 years now. This is the 27th day program. But we would like to join his team all the time and cascade the information, cascade the awareness, and let us become the forerunners in prevention of hepatitis, viral hepatitis B, C, and Sir will talk more about alphabets A to E. So I would not be commenting on that. So with that note, I once again congratulate all of you to be a part of this team, be a privileged team. But before I leave, I would definitely like to thank Dr. Ekta, who's always after me the whole year long, not just for this day. And she has been instrumental in motivating me towards some other initiatives like in the beyond maternal health. So we would like to cover more. So adolescents as well as elderly population we are going to cover after this. So thank you so much for having me here, and I hand it over back to the